standard of care is a term used a lot in the medical and legal world to describe this like baseline of quality of care that patients should receive when dealing with a certain like medical issue. So if somebody has a specific diagnosis, there is a standard of care of how that patient should be treated, what steps should be taken, and that is kind of supposed to ensure this equitable care that we all are kind of hoping to address with standard of care. But obviously, that's not always the case depending on the patient's identity and their circumstances. So we really wanted to kind of highlight that the fact that not everybody is receiving the same standard of care. So there's also a really long history of racism in medicine. I'm sure you might have heard that in the late 19th century, doctors practiced their surgical techniques on enslaved Black women, often, without anesthetic, often multiple times. And then in the 1930s, the US recruited hundreds of Black syphilis patients to participate in the Tuskegee syphilis study. They promised them free medical care, but in reality, they received placebos and diagnostic procedures, and researchers kind of observed the effects of their untreated disease for about 4 decades, even though we had developed drugs that would have helped those patients within that time frame. If you've heard of HeLa cells, Henrietta Lacks was a Black cancer patient whose cells were harvested for medical research without her consent. Her family has spoken out about this. There's a great book about it if you're interested in learning more about that. And then throughout the 20th century, hundreds and hundreds of Latina and Black people who were assigned female at birth were subject to compulsory sterilization, experimental birth control, medically unnecessary hysterectomies, and a lot of times these are done without informed consent. And so medical students are still actually taught myths that are rooted in these in our eugenic history. For example, there was a study that showed that I think it was half of white medical trainees believed that Black people's nerve endings were less sensitive, meaning that they don't feel pain the same way we do, which is not true. And that really affects Black people who have surgery today and who go into the ER with a broken bone. If your doctor doesn't believe that you can feel pain, that affects the kind of treatment that you're able to receive. They're also not trained to recognize certain symptoms in the way that they present in patients with darker skin, especially, personally, I have Ehlers-Danlos syndrome, and one of the diagnostic features of that condition is to have translucent skin. And for me, that means that my white skin is you're able to see my veins and things through that, but that shows up differently in patients of color, and that creates a really big barrier for them to get diagnosed. There are other diagnostic indicators that are also not as accurate for Black, Indigenous, and Latin patients. Pulse oximetry, which is used to evaluate breathing and has been used a lot in COVID to decide who gets a ventilator. They're dangerously inaccurate for darker skinned patients because they're reading through a light on your finger, and they were made and tested on white patients. So yeah, Black and Indigenous people of color have been left out of drug testing. Doctors can't recognize important disease features. Diagnostic indicators aren't accurate for them. Some of the tests that are used to determine who gets a kidney transplant have different parameters for Black and white patients. So as a result of all of this, they've been disproportionately affected by COVID-19 and other poor health outcomes, and a lot of people of color have trouble trusting the medical system. And that's something that we could easily change by educating students about these kind of medical myths that are still floating around in their textbooks, and by giving Black and Indigenous people of color more opportunities to be doctors and to speak to doctors, and having their doctors listen to their patients of color.